Hi to all. Let me proceed further now and try to understand the further things which are available for us in terms of the types of reviews that I can go ahead and write. Number one. Number two, the kind of the protocols that are being used and the kind of the questions which are available for us. So in the previous video of mine, I have showcased to you effectiveness in your review type, experiential or qualitative review type, cost and economic evaluation. The fourth one which I'm going to discuss right now is on prevalence or incidence. Now you see, you can use both of them together, prevalence and incidence. Prevalence or incidence, that is the difference between and or. So be very careful to determine the prevalence and incidence of a certain condition, or prevalence or incidence of a certain condition. So here they are using Coco Pop, and the question is, what is the prevalence or incidence of claustrophobia and claustrophobic reactions? Now see the questions that they have come up out here. Now try to understand how well they have formatted it and they have taken care of it. Okay, so I'll be talking a lot about Coco Pop in depth because this is something which I really like it, and help others in coming up with the papers or the questions using this particular I would say protocol. The next one exclusively belongs to the medical field, which is a diagnostic or test or the accuracy one. Now to determine how well diagnostic test works in terms of its sensitivity and specificity of a particular diagnosis. Now here they are using PIRD. Okay, and what is the diagnostic test? Accuracy of nutritional values. Now somebody who is trying to test the accuracy, let's say in business studies or international business or even marketing area, because I belong to those areas more, so therefore I'm talking in terms of them. Can you go ahead and say that yes, I'm going to perform the diagnostic test in terms of this and this and use PIRD? No. Again, so we will see what is the notebook is telling us and how well they have defined it, so that I can go further. Next is the etiology and or the risk part of it out here, to determine the association between particular risk factors, and they are using PO. Now this is something I would say that yes, all the domains can use this particular format or the protocol. Expert opinion. Now here they are using more of the PIC with O small o out here. So to review and synthesize current expert opinion in case text or policy on a certain phenomena. So you have got the choices between what and what. You have got the choice between current expert opinion. This is the number one, I would say. Number two is the text. What is available in your textbooks? That's number two. Number three, the policy which is being taken care in your own country. Look at those policies and you can then proceed further with the similar kind of a policies or the phenomena, however the different policies in other countries, and then you can think about it. Now what are the, now look at the question, what are the policy strategies to reduce paternal mortality in pregnant and birthing women in Cambodia? So they have taken Cambodia, Thailand, Malaysia and Sri Lanka. Now if you go ahead and try to look at the papers or the notebook that they have taken, then you will be able to understand as to how I can proceed further. Psychometric test to evaluate the psychometric properties. So anybody who's coming from that area can definitely look into it. When I'm talking about the measurement and type of the measurement, these things I will definitely discuss in a different context altogether, and what kind of a thing. There is a completely a body which governs all these things, so we will see this thing. So this is the seventh one that is there for us. Eighth kind is prognostic. to determine the overall prognosis for a condition, the link between the specific prognostic factors, outcome, and the prediction models for those particular tests. So here they are using PFQ or PPF. PPF also is there, or you can say it as PFO, that is the protocol name out here. In adults with low back pain, what is the association between the individual recovery expectations and the disability outcome? So this is the association that they are talking about. However, look again at the notebook, and then you decide that yes. So I think time has come for me. I thought these were available. I think it's a mistake from my side. So let me go ahead and showcase those notebooks also in my future video, so that you are able to know what kind of questions we can go ahead with also for our own research. The ninth one that they're talking about is the methodology. Here we go. To examine and investigate current research methods and potentially, this usually we do in literature kind of a thing, review also. Now, types of studies, types of data, types of methods and outcomes which we are normally taking care of, which is called as SDMO. This is something which all of us can use it in our quantitative study. So 2 or 3 of them are there. So try to understand how it is, where they are coming in from, and what kind of things are available, so that we can carry forward. Let me just see if I can share something else from this particular paper. However, you should read the remaining paras also in this particular paper, so that you are able to understand the context and how well they are able to come up with these kind of things which are present. So we can go ahead and I think we can discuss it more into this kind of a thing and try to understand more. So I'm going to stop here. There is nothing more that I want to share as per the theme of my video presentation, which is continuing one after the other. And let me come up with yet another paper wherein more in-depth things can be understood for these protocols also. Till then, thank you and take care. Bye.